Welcome back. Now, the new way to jump the queue for elective surgery. It's a user-pays system designed to replace private health insurance, but not everyone's convinced.
The best decision I've ever made.
I was in pain all the time. Now I'm having days where I've got no pain in the shoulder.
It's not a replacement for health insurance. Buyer beware.
No private healthcare, no worries.
I had high blood pressure. It was under control, but then my dad passed away about a year ago and we were very close and that impacted my life and my blood pressure just shot up after that. Medication wasn't working and the doctors recommended that I do the surgery to lose weight.
Nehru's underwent gastric sleeve surgery in December last year with Healthy Care Australia's self-pay surgery, a program aimed at providing private hospital services and facilities to people without private health cover.
First consultation with the doctor was really well. I liked what he had to say. I liked how he explained everything. The price was around my budget and the service was amazing.
The procedure set Nehru's back $15,000, which she says included the surgeon's fee, anaesthetist and hospital accommodation.
How has your life changed post-surgery?
I can actually run with my kids, play. I'm not tired as I was before. My blood pressure is completely gone. My health is better than what I was 10 years ago. 2
rotator cuff tears, a spur on the bone and the bicep on the arm off the bone had come off.
In pain and without private health insurance, Alec turned to self-pay surgery.
Private healthcare is too expensive and you still have to be out of pocket at the end of the day. Going through public was going to take about 18 months, maybe 2 years to be put on the waiting list. All up was $10,850.
Healthy Care Australia says it offers patients a package deal at a single price.
The idea is not to provide cut price procedures, it's actually to provide a full service as we would if they were an insured patient.
Jeff Sams, director and co-founder of Healthy Care Australia.
The patients are receiving the same service from the same surgeons and anaesthetists and nursing staff that we use for private patients. If anything untoward might happen through the procedure with a patient, then we wear the risk and we continue to provide the care to that patient.
The average wait time for elective surgery in a public hospital is 39 days, according to the Australian Institute of Health and Welfare. But it depends what surgery you're after. You could wait up to 223 days for a total knee replacement, 129 days for varicose veins treatment, and 120 days for a hip replacement.
Private health insurance can minimise out-of-pocket costs and wait times, but you'll pay from $94.45 per month with HCF, $100 with Frank Health Insurance. AHM will set you back from $130.60 per month. You'll fork out $141 for Medibank, and Qantas Insurance is from $166. So what's the best option for consumers?
It's a difficult question to answer, and I think that the rise of these sorts of companies stand testament to the fact that private health insurance has really dropped the ball in the last few years.
Orthopaedic surgeon Dr. John Cunningham has his concerns.
As a surgeon, I feel happier treating a patient who I know is insured, who won't be up for hundreds of thousands of dollars in case something happens. And these are the questions that I'd be asking is, what happens if I suffer a complication whilst under their care? Who's going to pay for that?
Dr. Cunningham's advice to patients:
I'd talk to their surgeon first of all and find out if their surgeon themselves already treats self-insured patients. I would always recommend someone gets a second opinion and finds out what the likely costs are of going through alternative means.
I'm more than happy at the moment. It's like it's given me a whole new life.
All surgeries come with risks. Always speak to your GP.